Hi friends, I'm Dr. Jeevat Ram. Today I will discuss about measles and its management. It is an infection of respiratory system, immune system and skin caused by a virus, especially paramyxovirus, also known as morbillivirus or rubella. Incubation period is 7 to 10 days. It spreads through respiration, contact with fluid from infected person's nose and mouth, and is highly contagious. Period of infectivity is 4 to 9 days. Definition of measles. Measles is an acute highly contagious viral disease caused by the measles virus. It is characterized by fever, upper respiratory tract catarrhal inflammation, complex spots, and maculopapules. Measles is characterized by small red dots appearing on the surface of the skin, irritation of the eyes, especially on exposure to light, coughing, and a runny nose. About 12 days after exposure, the fever, sneezing, and runny nose appear. Measles virus. Measles virus is a single-stranded, negative sense enveloped RNA virus of the family Paramyxoviridae, genus Morbillivirus. Humans are the natural hosts of the virus. No animal reservoirs are known to exist. Entry of the virus. The measles virus has two enveloped glycoproteins on the viral surface, hemagglutinin and membrane fusion protein. The proteins are responsible for host cell binding and invasion. Evolution. The measles virus evolved from the formerly widespread rinderpest virus which infects cattle. What is measles? Measles is a highly infectious illness caused by a virus. The virus lives in the mucus of the nose and the throat of people. Physical contact, sneezing can spread the infection. In addition, infected droplets of mucus can remain active and contagious for around 2 hours. This means that virus can live outside the body, for example on surfaces and door handles. What are the symptoms of measles? Once a person is infected with the virus multiplies in the back of person's throat and lungs. It then spreads throughout the body. The following are the most common symptoms of measles. A high temperature, sore eyes and a runny nose usually occur first. Small white spots usually develop inside the mouth a day or so later. This can persist for several days. A harsh dry cough, diarrhea or vomiting is common. A red, blotchy rash normally develops about 3 to 4 days after the first symptoms. It usually starts on the head and neck and spreads down the body. It takes 2 to 3 days to cover most of the body. The rash often turns a brownish color and gradually fades over a few days. Most persons are better within 7 to 10 days. An irritating cough may persist for several days after other symptoms have gone. The immune system makes antibodies during the infection. These fight off the virus and then provide lifelong immunity. It is therefore far rare to have more than one bout of measles. Some people mistake rashes caused by other viruses for measles. Measles is not just a mild red rash that soon goes. The measles virus causes unpleasant and sometimes serious illness. The rash is just a part of the illness. How is measles diagnosed? Physicians will usually be able to diagnose measles from the combinations of the symptoms, especially the characteristics, rash and the small spots inside the mouth. However, a simple blood or saliva test is usually done to confirm diagnosis. Possible complications of measles. Complications are more likely in children with a poor immune system, those who are malnourished, children aged under 5 years, and adults. More common complications are conjunctivitis, eye infection, inflammation of the voice box, ear infection, infection of airways such as bronchitis and croup are common. This is a table depicting the complications to organ system by measles. Treatment of measles. There is no specific medicine that kills the measles virus. Treatment aims to ease symptoms until the body's immune system clears the infection. For most cases, rest and simple measures to reduce fever are advised. Symptoms will usually disappear within 10 days. Following measures are useful. Should drink excess water to avoid dehydration. Paracetamol or ibuprofen can be taken to reduce fever. Antibiotics are prescribed if complications appear. Measles immunization. Two doses of vaccine are usually the first for children aged between 12 to 13 months and second usually given at the age of 3 to 5 years. Immunization gives excellent protection and so measles is now comparatively rare. Aims of treatment: to relieve symptoms, to treat complications, to prevent death, to maintain good nutrition. General measures for measles: tepid sponging for fever, encourage oral hygiene, continue feeding with soft high-calorie foods, wash eyes with clean water. Pharmacological treatment of measles. There is no specific treatment for measles since it is caused by a virus, so it is managed symptomatically. Tablet paracetamol 1 gram every 8 hours for 5 days plus capsule vitamin A 2 lakh international units orally plus tetracycline eye ointment 1 patient apply once daily for 7 days. Children, give paracetamol 10 to 15 mg per kg body weight every 8 hours for 5 days plus capsule vitamin A. If less than 1 year, give 1 lakh international units state, and if over 1 year, give 2 lakh international units. Apply calamine lotion for skin irritation applied to the affected areas.